His main strategies, the things that can help you build a more stable, fulfilling life. Okay, let's dive in. So first off, we hear mood swings a lot. But what does Miklowitz say bipolar disorder really is? How does he define it differently?
Right, that's key. Miklowitz makes it really clear it's much more than just fluctuating emotions. He defines it as a serious medical condition. You have these distinct episodes, extreme highs, mania, or sometimes the milder hypomania.
Okay.
And then the lows, the clinical depression. He stresses the biological roots, the psychological ones too. It's not just being moody.
It's got a physical basis.
Absolutely. And he says recognizing your own patterns, those specific triggers, that's crucial for managing things, for preventing relapses early on.
That makes sense. Understanding it deeply is step one. So what are the core strategies he lays out in the guide? The foundational stuff for managing it?
He outlines a few really powerful principles. First, and he really hammers this home, is that education is power.
Knowledge is power.
Yeah, but specifically learning about your symptoms, your triggers, your warning signs, knowing that personally reduces fear, and stigma too. It makes you active in your own care. Then there's medication. He says medication is vital, often the bedrock with mood stabilizers.
Meds are important.
But it's not everything. It works best combined with therapy, lifestyle changes, and good support systems.
It's a package deal.
Exactly. Which leads to his third point, developing a personal management plan. And this is more than just like noticing your mood. He pushes for detailed daily tracking, connecting actions or stress or sleep changes directly to mood shifts. Using journals, maybe apps.
Mood charts.
Mood charts, yeah. Anything to spot those early warning signs so you can act before things escalate. Precision is the goal there.
That sounds really empowering, having that level of detail. What about lifestyle? How specific does he get there, especially since routines can be so easily disrupted?
Oh, he really drills down on lifestyle adjustments. Sleep is huge. Consistent routines, too. He explains how disrupted sleep can actually trigger episodes.
So it's not just general advice, it's biologically connected.
Precisely. He gives practical tips on sleep hygiene, maintaining structure day to day. It's like a biological anchor for stability. Diet, exercise, stress reduction, they're all in there, but linked directly to how they reduce vulnerability to mood shifts.
It's clear it takes a village, almost.
Yeah.
The guide talks about the impact beyond the individual, right? How does he address family and social support?
Absolutely. He emphasizes families, partners, friends, they're all deeply affected. The guide really encourages families to learn about the disorder together.
Not just the person diagnosed.
Right, so everyone understands. He suggests specific ways to communicate better, reduce conflict, and critically, for families to spot early signs so they can support, not control. And he highlights family-focused therapy. There's actual evidence it significantly reduces relapse rates and improves relationships. That's a big one.
That's powerful data. Okay, so what about when things get tough? When symptoms flare up or escalate, what practical advice is there for coping in a crisis?
He stresses having a plan ready before you need it, a relapse prevention plan. Know the steps, who to call, what interventions help you.
Like an emergency protocol?
Sort of, yeah. And knowing when to get urgent help, because mania or depression can escalate fast. But also, and this is important, developing self-compassion, patience.
Yeah.
Recognizing recovery isn't usually a straight line. It's trial and error, course corrections. Accepting that is part of the strategy.
Okay, so bringing it all together, what's the main takeaway? The big message of empowerment from this guide.
I think the core message is that bipolar disorder is manageable. It takes work, yes, but it's manageable with a combined approach. It's that synergy, really. The education, the right medication, the therapy, those structured routines tailored to you, and a strong, informed support network. Miklowitz offers a really hopeful, practical message. Stability is achievable. A fulfilling life is definitely possible with the right knowledge and strategies.
She stresses that stability is achievable and life can be fulfilling.
Yeah.
For you listening, thinking about this combined approach, the education, meds, therapy, routines, support, which one of those pieces do you feel holds the most potential to really transform daily life, to give you that tangible sense of control?
This video is presented by International Psychology Association. Follow us for more psychology updates.